When you hear the term physiotherapy or physical therapy, what springs to mind? Hi, I'm Sam, physiotherapist at Club 360, and this is Yoav.
Hey, I'm Yoav.
Many people might have preconceived ideas about what a physiotherapist does or what physical therapy is, and as a result may be hesitant or even a little intimidated in seeking treatment. They might be worried that a physiotherapist might perform painful treatments or even tell them to stop doing their sport or stop doing something that they really love. So today we're going to show you what it is like to meet a physiotherapist for the first time. Let's get started. So we're going to use a case study to illustrate a sample physiotherapy session. So in this case, we have Yoav, who's experiencing knee pain. Now, in any sort of injury, we generally have two types of injury, an acute injury, a traumatic injury, or a gradual sort of overuse injury. An example of an acute traumatic injury would be if Yoav was suddenly tackled from the side. The most important aspect of the consultation is the interview, where we glean much of the information we need to start formulating a working diagnosis and treatment plan, as well as screen for red flags that could suggest a more sinister cause of the problem. So because Yoav is a runner who's experiencing pain, we need to guide our assessment towards movements that are relevant to his sport or his activity. So something that we might want to test is a single leg squat. So Yoav, can I get you to stand on one leg and just do a little bit of a dip on the leg? So bending your knee to about 30 or 40 degrees. Okay, how's that feeling? Is that sort of reproducing your pain?
Yeah, I feel a little bit of pain at this area when I'm going down.
So this is not only useful in terms of helping us form our diagnosis, but it's also good in terms of assessing his load tolerance and his sensitivity to a movement that is relevant to his sport or activity. So that's an example of a test that we could use. And then what we want to do is see if we can change the pain that he's experiencing with that test. So we might go straight to the area that's painful. And Yoav, I'm going to get you to do exactly the same test again for me, please. So going down into that squat, and I'm applying a glide to his kneecap, and then come back up. How does that feel?
A little bit better.
A little bit better. Okay. So if we can modify his symptoms, we may actually perform that movement as a treatment. So Yoav, I'm going to get you to do another 5 repetitions for me. Okay. And then we'll get you to reassess that movement. Does that feel a little easier?
A little bit easier.
Yeah.
Yeah.
So we're starting to formulate, even before we make our diagnosis, some possible treatment techniques that we can use. So the next part of the assessment process involves performing specific tests to try to isolate the structural area that is causing the symptoms. So attempting to make a structural diagnosis. When I push down there, is that reproducing any of your symptoms, Yoav?
Yeah, a little bit.
Yeah. In some conditions, it's really important to make an accurate structural diagnosis, such as a fracture, because the treatment and the management will differ depending on what structure is involved. In other conditions, such as non-specific lower back pain, for example, it's far less important to make an actual structural diagnosis, but it is really important to know what sort of movements are reproducing the person's pain and what sort of the movements are perhaps relieving their pain. In addition to identifying the area of the body that's painful, we also want to see what else is contributing to his symptoms. Now, this might be things like his sleep or stress levels, but it might also be his biomechanics, so the way he's moving. So in Yoav's case, we've identified through assessment that he has some restriction in his ankle range of motion, which is therefore placing excessive pressure on the knee and contributing to his symptoms. So push hard as you can, push, 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 push. And relax. And then another thing that we've identified through assessment is that Yoav has some relative weakness through the hip on the affected side. And so this is something else that we may want to address, as it may also be contributing to his knee symptoms. As Yoav's a runner, we do want to assess his running to see if there might be any technical aspects that are also contributing to his symptoms.
The most important aspect of the treatment process is education, informing the client about the nature of their issue, the likely recovery time, and the necessary interventions required. For most issues, imaging is not required. However, in some cases it is, and we can also talk through this. In Yoav's case, we identified training load as a possible causative factor and discussed strategies to address this.
So part of the treatment might involve treating the injured or sensitized area directly. So we know that Yoav has pain originating from the joint between the kneecap and the thigh, so we might perform some local manual therapy to address that area. So we can then reinforce that technique with the use of some taping. And that way, Yoav has a self-treatment technique that he can use to modify his symptoms. The first exercise that we're going to include is something that we can use to build load tolerance through the injured site. Now we know that Yoav experiences too much pain with the single leg squat to really want to prescribe that as an exercise, so we can use a regression of that pattern in the form of a split squat. So we're still getting a lot of load through the knee, but we're using the back leg to provide some support. So Yoav, in that position, can I get you to bring your back leg down to touch those blocks? How does that feel?
Yeah, it's fine.
That's okay? All right. So we can then progress this exercise as we go through our treatment progression, either progressing the load by getting Yoav to hold on to some weights, and then perform the movement now with the addition of external resistance. And then we could progress that also by increasing the depth. So we can get rid of the blocks so that now he's going down through a greater depth, therefore gradually increasing the load on the sensitized body part. And then we also want to address the other things we've found on his biomechanical assessment. So we're going to give Yoav an exercise to work on his ankle mobility. And then we want to address the hip weakness that we identified. So then another part of the treatment might be addressing some of the technical aspects of Yoav's running that we identified earlier. So for example, if he was running with an excessively long stride that might have been placing excessive pressure on his knee, we might encourage him to increase his cadence or the number of steps that he's taking. So at the end of the session, we have a structural diagnosis. We have a test that we can use to reassess how the injured part of the body is progressing. We have identified biomechanical factors that we've addressed with exercise. We've given Yoav a strategy such as taping or a self-treatment technique that he can use to address his symptoms. And then we've also discussed a potential cause of his problem, in Yoav's case, his exercise load, and we've discussed strategies that, that we can use to address that. So I hope you've found this clip useful, and I hope it's perhaps given you a little bit more confidence in terms of seeking physiotherapy treatment. If you've enjoyed the content, then please subscribe to our channel for more regular fitness and rehab information. And don't forget to check out our Instagram channel, where we're also posting fitness related content, but also posting a little bit more about our community. If you're interested in more information about the knee, we did record a webinar on anterior knee pain, which you can find right here. So thanks for watching, and we look forward to seeing you on the next episode.
Bye-bye.